Hi YouTube! So welcome to the end of my 2 weeks of emergency medicine. I thought I'd do a quick update. So just finishing up the weekend here. I'll just start with, I guess, my last week. I worked Monday through Thursday. I had Friday off. And I pretty much go in, like I said, my doctor kind of lets me, since she works crazy hours, she's like, you shouldn't have to work crazy hours. So she lets me come in the morning, and she calls if we have a patient earlier, but sometimes we don't have a patient in the morning. But I'm usually try to be there between 8 and 8:30. And then, depending on the night, I'll come home between 9 p.m. or 11 p.m. usually. Sometimes it's later, probably not earlier. And so I wake up, I shower, I make my coffee, have my little breakfast bar, and I go in, and I come home, and everybody's sleeping here, and the lights are all off, and I come in, and I brush my teeth, and I put my pajamas on, and I go to bed. That's what I do for 4 days straight. It's crazy, but I love it. I don't know what I'm running on, adrenaline or something, but I am loving every single minute. So, everything's kind of a blur. I had to record all my patients' information. Like, we have to record all our patient encounters. So I'm trying to think back to that. But Tuesday, I ended up going to a funeral. And that was, reflecting back on that, I'm really glad I went. I went to represent the hospital I'm at. And also, I kind of was glad I was able to go, for closure and everything. And I'm just really glad I went. But, I could probably go to any funeral and cry because that's just who I am. And just hearing about how many other people's lives they've touched and what they've done with their lives and things that I didn't know about them. Anyway, so I went with the chaplain and we went in, and like I said, I'm glad I went. So if you have the opportunity, if someone presents you with, if you want to go to this person's funeral, I would recommend it because I will never, ever forget that. And I guess, I don't know, I want to be that caring physician. I want to know how best I can help the family members of someone who's died and everything. And right now I have the time. I know, being a family physician, I may not have the time to go to every single one of my patients' funerals, and so why not take the time right now? I do have the opportunity to do it. Anyways, that's my soapbox on that. But and then also, one thing I want to tell you guys is, if you're on rotations, and most of you, I'm guessing, how you get your grade. Anyways, our school has the physician fill out an evaluation form, so you get graded on a scale of like 1 to 5, and there's all these different topics or things they grade you on, and they spell it out too. It's not just 1 through 5. It's 1 means they're doing this, 2 means they're doing this, so it helps them. I'm so glad they do that, because I hate when I have to fill out surveys 1 to 5, and I'm just like, I don't know, was a 4 versus a 5? And so at the end of your 4 weeks, they fill that out and send it to your school, and then your school decides if you pass or not, I think. That's my understanding of it right now. But earlier this week, I'd asked my physician if she wouldn't mind looking through the evaluation and kind of giving me a midterm report on myself and how I'm doing as a third-year medical student. And Wednesday, she surprised me by telling me to come over by her computer and read this email that I had noticed she had sent to some of the deans of my college. And she had written me this, or not me, it wasn't to me, but she had me read it. And she wrote this wonderful email about me, saying how thankful she was that my school sends such high caliber students, and I had great history taking skills, and physical diagnosis and physical exam skills. And she talked about a case that I was involved with and how wonderful it was that I was able to follow that. And it was my only second day on my rotation, and she was blown away at that, because I had performed at a third-year student, not just a third year on their second day of rotation. So, that was quite the midterm report, just reading that. I'm sure I sat there and I blushed, because I'm not good at taking compliments, but oh my goodness, I was on top of the world with that. And she still went through the evaluation with me and circled like where I would be at. And so she gave me some ideas for room for improvement. So with that, I would recommend to all students, first off, print off your evaluations. I'm guessing every school allows you to see what you're being evaluated on. So print that off, keep that with you, read it before every rotation, maybe read it halfway through your rotation or however often you need to read it to see what you're being graded on. And so that was just helpful, number one. And number two is, if your physician is willing, have them do like a midterm report, because then you can actually improve. I mean, what good is it if you get an evaluation back and maybe you don't even see what you get on? Maybe it just goes to your school and you don't get a copy of it and see your strengths and weaknesses. And so at least this just helped me see where I'm at, where I can improve, where I'm doing good in, and everything. So word of advice, print that off and have your physician possibly review it with you halfway through. And so I did that, and I now have some ideas on where I can improve and everything like that. So that really helps me. Let's see, I only worked Monday through Thursday today. I had Friday off because my physician had Friday off. So I ended up going shopping. One of the nurses invited me to go with her family to go shopping. So that was really, really nice. I swear I work with some of the nicest people in the world. And one of my days, I had a patient come in kind of towards the end of the day, and my physician had me stay because it was possibly a trauma case, and I hadn't seen very many trauma cases because the ambulance had gone out. So I stayed around, and I'm so glad I did, because this was a patient I had already seen before, and she has pretty bad dementia, so I didn't expect her to remember me, but she just really stands out in mind as one of my first patients, and just everything going on, I was able to do a transfer with her for the first time she was in the hospital, and then so this time around I didn't expect her to remember me, but she actually did, which surprised me. I already knew the family members, so them coming in, they recognized me, and I was able to sit and talk with them for a while. And the reason I'm bringing this up is because this is the highlight of my week. This is like my high. And I went in with her to the radiology room. I volunteered myself to help out, and I just really wanted to go with her, because when you have dementia like that and you're in pain, like you don't, I mean, she kept asking, why am I here? What's this hard thing on my back? And, it was just helpful to have maybe one familiar face with you throughout the whole thing, which I know as a physician and nurse and everyone's busy and can't necessarily do that. And I was there, and so I could do that for her. So I went in there with her and just held her hand and made sure, she was covered with her blanket, and, just talking to her about kind of random things, but to keep her mind off the pain, hopefully. And she looked up at me at one point, and she looked right at me and she said, dear, the pain isn't so bad when you're with me. And oh my gosh, I almost started like tearing up, because that was just, even though I had that really nice email my physician wrote me, that was the high of my week, is being able to connect with my patient. And even though I didn't give her any pain medicine or I didn't do anything else, oh my goodness, just knowing that my presence and me holding her hand and being there for her helped her pain. I mean, that just, it made my whole week, and that's why I want to be a physician, for one of those reasons. And anyways, that was the highlight, and I thought I would share that with you guys. I've learned so much on this rotation, knowledge-wise and patient-wise and everything, but that, I'll never forget that moment. And also, another thing that was really exciting is I am a DO student, so osteopathic medicine, so we also learn manipulation medicine. And we had a few patients this week that we were able to use it on. Usually in emergency medicine, you don't, obviously someone comes in with a heart attack or stroke or something, you're not going to be using that as your first line treatment by any means. But we had a few cases where I was able to, and one patient thought she was going to come in and have to be admitted and be transferred and all this stuff and have a huge workup done, and it really wasn't. I was able to help her with my OMM skills, and she sat up and was like, oh my goodness, it is 100% better. I never thought I would ever feel this way. And she was just, she shook her hands and was just so excited. And I don't know, it was really exciting to be able to use my skills and to be able to help someone out like that, because maybe if I had gone to a different school, I wouldn't have had that. And oh, it was so, so exciting. I used some just easy myofascial release, not something I had to look in my book for, something I had remembered, and it was pretty easy. And she said she couldn't believe it. She was like, I thought I would have been so much pain that I would have to be admitted and all this stuff, and it was a pretty easy fix. So that was exciting too. Man, I had quite the exciting week. And I could use some of my OMM on some of the nurses. They appreciated that. They're like, oh, I'll be your guinea pig here. So it was good to get some of my confidence and work on them and alleviate some of their pain. Anyways, long week. I'm going to write my H&P. We had a patient. So I don't think I told you this. So it's Sunday today. And usually I'm not in on Sundays. And shoot, hold on, I have to plug my computer in. Ooh. It is going to run the battery. Okay. So usually, at least my schedule she had sent me before didn't have Sunday on it. But she had to take this extra shift. And I told her right from the beginning, if you're ever in or there's anything interesting, I'm like on the board and my phone number's there, so anyone can even call me during the night. And if my doctor's not working, I can just observe there and everything. But anyway, she was working today, and she called me in and was just like, we could definitely use your help. Do you mind coming in? And of course, I was like, absolutely, I'll be there. So I came in and helped out. It was busy. Things were going on, and there were a few cases that were quite more involved, and so I got to help out with that, and I learned so much today. I'm so glad they called me, because it's funny on how, like, I was all set up. I had slept in, and I was gonna start all my studying, and I had a nice cup of coffee and everything like that, and I got called in. I kind of was like, okay, I'll just go in maybe for a few hours. Of course, that's how I start off, but I didn't even want to leave. I mean, I learned so much today. It's so true. You learn so much from the patients and the cases you have. Anyways, we admitted a patient, and I got to write the admit note, which I could always use practice on, and it's finally getting easier. I've written a few, maybe only 2 of them now, I guess, but it's getting easier. And I'm going to write up my H&P note, which I don't know, I never called it that before. I think it's just your soap note. And then I'm going to go early and around on my patient, and I told the patient I would be in to check with them in the morning, and that's so cool. That continuation of care is what I live for. So it's so fun being in a smaller hospital where I can see them in the ER and then see them the next day in the hospital. But I have to do that still tonight because I want to get that done. She said I don't have to, and she told me if I want to round on them in the morning and come home and sleep, and then come in when the physician comes in to round on them, I could do that, or whatever. I have quite a bit of freedom in this rotation, but I'm learning so much, and she knows I'm kind of a go-getter and will motivate myself and go the extra mile to do that, so maybe that's why I have a lot of freedom. But anyways, that is my week. I told you guys my highlights, and it's exhausting. I think I already mentioned this, but I seriously get up, I go in, run around, come home, sleep, wake up the next day, and I don't know how people do it with families. I mean, good for them, because, oh man, if I had children right now, I don't think I would see much of them. So, wow, good for you guys of trying to be able to balance that. And it kind of helps being away. John and I are apart right now because we're both in different towns doing different rotations, and being busy kind of helps me not miss him as much. So it helps, like I said, being busy, and then when I do get to talk to him, it's so great. We get to fill each other in on our weeks. Even, I mean, I think we went like 3 or 4 or 5 days without talking. But then I was able to talk with him. I was able to talk to my little sister on Skype this weekend, and that was so great. Talked to her for over an hour. And then talked with both my parents via Skype, which is such a great invention because it's so fun filling them in. And she's supposed to be watching these videos to, because I told her I can never remember everything when I'm talking to someone, so I told her to watch my videos. So hopefully, Mom, that you're watching this, because here's a shout out to you. We'll see if you hear this, so call me when you actually watch this and hear me say this. But anyways, that's one of the reasons I do these videos, is to keep my family in the loop. That's about it. I'm going to bed. I'm actually going to write my note and then go to bed, and I'm probably talking on and about boring stuff you guys don't want to hear anyways. So I do want to continue. I want to do a case study. I have one in mind. I'm working on it right now, but I have to make it up because obviously I'm not going to do it on a patient that I saw. But something I think you would definitely see in the emergency room. And so I'm writing up a case for you guys, and I will post that maybe this week, maybe next. I don't know. John and I are flying out of state to go to a wedding later this week. So that is it, I think. Whew, what a week. Anyways, I am write my note, and I'm going to bed. I'm really tired, so I'll see you guys later.